In the morning, you might be doing everything right for your heart, taking your medications diligently, trying to eat healthy, maybe even enjoying a walk around the neighborhood. You believe you're managing the known risks for a heart attack, like high cholesterol or high blood pressure. But what if I told you there's a hidden enemy silently at work inside your body, in a place few would suspect could determine the fate of your heart, especially after age 50? No, this isn't what you typically hear in health news. This isn't an empty warning. Here's a shocking truth. According to a recent report from the U.S. Centers for Disease Control and Prevention, up to 70% of American adults aged 65 and older have some form of gum disease. And what's more alarming is that this seemingly localized oral condition could be a silent risk factor for deadly cardiovascular diseases. We're not talking about common cavities. We're talking about hidden, smoldering inflammations, gum diseases you might not even know you have, that could be poisoning your vascular system and directly threatening your heart health day in and day out. For those over 50s, this is information you absolutely cannot afford to ignore. Welcome to our channel. If you're feeling a sense of unease, perhaps a little skeptical, or even worried right now, that's completely understandable. But don't click away, because throughout this video, we will not only expose this silent danger in the clearest, most scientific way possible, but more importantly, we will equip you with specific knowledge and actionable tools to protect yourself. Welcome to our channel. If you're feeling a sense of unease, perhaps a little skeptical, or even worried right now, that's completely understandable. But don't click away, because throughout this video, we will not only expose this silent danger in the clearest, most scientific way possible, but more importantly, we will equip you with specific knowledge and actionable tools to protect yourself. So, let's delve into one of the most common, yet underestimated, enemies lurking in our mouths: gum disease, also known as periodontitis. It's incredibly prevalent. In fact, data from the National Institute of Dental and Craniofacial Research, NIDCR, suggests that a staggering 70% of adults aged 65 and older in the U.S. have some form of periodontal disease. Now, this isn't just about occasional bleeding gums when you brush too hard. We're talking about a persistent, chronic inflammation. Bacteria from plaque buildup and infected pockets around your teeth can easily enter your bloodstream. From there, these unwelcome guests travel throughout your body, triggering systemic inflammation. This inflammation is a key player in the thickening of artery walls and the formation of those dangerous plaques, atherosclerosis, which is a direct precursor to a heart attack or myocardial infarction. Imagine your inflamed gums are like a smoldering fire in your mouth. The smoke and heat from that fire, those are the inflammatory substances, don't just stay put. They spread, impacting the entire house that is your body, especially your precious heart. It's a profound connection, and understanding it is the first step towards taking control. What's particularly concerning is that many oral health issues, including early-stage gum disease or even deeper infections like tooth abscesses, some of which have been highlighted in research, such as those discussed by Dr. Thomas Levy in his work on hidden oral infections, often don't cause noticeable pain. They can progress silently, under the radar. This is alarmingly similar to how silent heart attack symptoms can manifest, those atypical signs that are easy to dismiss until it's critically late. For instance, a study published in the Journal of the American Heart Association found that nearly 45% of all heart attacks appear to be silent, meaning the individual may not even realize they've had one. This is why regular, thorough dental checkups are so vital. If you have existing root canal teeth and are concerned, or if you have other cardiovascular risk factors, discussing advanced diagnostic options with your dentist, like a 3D cone beam CT scan, which some modern practices offer, could be a proactive step to uncover these hidden issues before they escalate. It's important to note that root canal treatment is often essential for saving a tooth and eliminating acute infection. However, as some dental research points out, completely sterilizing the microscopic tubules within a tooth can be challenging, potentially leading to a low-grade chronic infection in some instances. This is an area of ongoing study and discussion within the dental community. The key takeaway here isn't to fear necessary treatments, but to foster open, informed conversations with both your dentist and your doctor about your overall health picture, especially if you have persistent, unexplained inflammation or cardiac concerns. Knowledge truly is power, and it empowers you to ask the right questions and seek the best care for your unique situation. So, how exactly does what happens in your mouth impact your heart? It might seem like a long journey from a tooth to your heart, but the connection is surprisingly direct. Let's break down a few key mechanisms, and I promise to keep it simple and clear. The oral microbiome, a delicate balance. Your mouth is home to billions of microorganisms, bacteria, viruses, fungi, forming a complex ecosystem we call the oral microbiome. Think of it like a tiny, bustling city. When good citizen bacteria are in charge, everything runs smoothly. But if troublemaker bacteria take over, often due to things like poor hygiene, a diet high in sugar, or even stress, problems begin. The Forsyth Institute, a leader in oral health research, highlights that there are over 700 different species of bacteria that can live in our mouths. It's this balance that's crucial. Visuals, simple animation of good versus bad bacteria in the mouth, showing bad bacteria multiplying under certain conditions. Chronic inflammation, the body's alarm system gone haywire. As we've touched upon, when harmful oral bacteria flourish, leading to gum disease or infections, they don't just stay in your mouth. They can enter your bloodstream. Your body's immune system responds by launching an inflammatory attack. While inflammation is normally a healing process, when it's chronic, meaning it's happening day in, day out due to persistent oral infection, it becomes destructive. This sustained body-wide inflammation can damage your blood vessels, making them stiffer and more prone to blockages. In fact, research published in the Journal of Periodontology has consistently shown a strong association between periodontal disease and elevated levels of C-reactive protein, CRP, a key marker of inflammation in the body that is also a risk factor for cardiovascular disease. This makes chronic inflammation a major risk factor for cardiovascular diseases. These harmful bacteria also produce toxins that flood your system, leading to a condition called oxidative stress. You can think of oxidative stress like the process of metal rusting. In your body, unstable molecules called free radicals attack and damage healthy cells, including the delicate cells lining your arteries. The American Heart Association points out that oxidative stress contributes to the development of atherosclerosis, hardening of the arteries, by damaging the vessel walls, which then allows cholesterol and other substances to build up and form plaques. When this protective lining is compromised by this rusting process, it's much easier for these plaques to form and for blood clots to develop, which, as we know, are primary causes of a heart attack. The inner lining of your blood vessels is called the endothelium. It's an incredibly important active layer that plays a critical role in regulating your blood pressure and keeping your blood vessels flexible and smooth, allowing blood to flow freely. Imagine it like a perfectly smooth, non-stick coating inside your arteries. However, the chronic inflammation and oxidative stress originating from oral infections can severely impair the endothelium's ability to function properly. This is called endothelial dysfunction. When this happens, your blood vessels can become less elastic and more constricted, which can contribute to high blood pressure and significantly increase your risk of serious cardiovascular events like a heart attack or stroke. It's truly empowering to understand these connections, as it highlights just how impactful taking care of your oral health can be for your entire body. It's truly wonderful to understand how interconnected our bodies are, and even more empowering to know that we can take proactive steps to protect our health. Sometimes, hearing about how others have navigated their health journeys can provide immense inspiration. Imagine for a moment someone much like many of us, perhaps a gentleman named Arthur in his early 70s. Arthur had been managing his high blood pressure for years and was diligent about his checkups. Yet, he often felt a persistent low-grade fatigue and had noticed his gums were more sensitive than they used to be. He didn't realize these could be connected to his heart health. After a thorough discussion with his doctor and dentist, they discovered an underlying gum infection that was contributing to his overall inflammation. With dedicated oral care and treatment combined with his ongoing management of his blood pressure, Arthur found his energy levels improving. His doctor even noted a positive shift in some of his cardiovascular health markers. This isn't a miracle. It's a testament to how addressing one aspect of health, like oral hygiene, can create a ripple effect of positive change. It powerfully illustrates that it is never too late to take control and make a meaningful difference in your well-being, especially after age 50. Of course, as we've discussed, dedicated oral care is a vital piece of the puzzle when we talk about how to prevent heart attacks, but it's essential to see it as part of a comprehensive approach to your health. Continuing to manage other known risk factors remains paramount. This means diligently working with your healthcare provider to maintain a healthy blood pressure, keep high cholesterol levels in check, and manage blood sugar effectively if you have type 2 diabetes. These elements work synergistically. In fact, the World Health Organization emphasizes that addressing multiple risk factors, including those often overlooked like oral health, can significantly reduce the global burden of cardiovascular diseases. Every positive step you take, no matter how small it may seem, contributes to a stronger, healthier you. Now, while our primary focus today is on the powerful preventative measures related to oral health, it's also wise to be prepared and informed about heart attack symptoms. Knowledge in this area is crucial. Recognizing the warning signs quickly, including those signs of silent heart attack, which can be subtle, can make a life-saving difference. The American Heart Association stresses that recognizing heart attack symptoms early and seeking immediate medical attention can dramatically improve outcomes and chances of survival. We understand that the thought of experiencing a heart attack alone can be frightening. That's why, in a future video, we plan to delve deeper into what to do when having a heart attack alone and share specific guidance on how to survive a heart attack when no one is around to help you. But for now, let this awareness motivate you even more towards prevention. Many individuals who have shared their near-death experiences stories often speak of a newfound appreciation for proactive health choices they wish they had embraced sooner. We can learn from these experiences and make those choices today, starting with the health of our mouths to protect our precious heart. Remember, you are not just a passive recipient of your health, you are its most important guardian.
It's truly heartening to witness the positive changes that can occur when we take informed, proactive steps towards our health. Consider a story, perhaps like that of a lady we'll call Mary, who at 72 was managing several risk factors for a heart attack, including high blood pressure. She hadn't realized the serious impact her persistent gum disease was having until her dentist and doctor connected the dots. After dedicated periodontal treatment, combined with her continued efforts to manage her blood pressure and embrace a healthier lifestyle, Mary not only found her oral health transformed, but also saw remarkable improvements in her cardiovascular markers. She felt a new surge of energy, allowing her to enjoy precious time with her grandchildren more fully. Mary's journey is a powerful reminder that it's never too late to act for your health. Even small, consistent efforts can yield significant rewards, especially as we navigate life after age 50. Of course, while dedicated oral care is a crucial component in our discussion on how to prevent heart attacks, it's one important piece of a larger, holistic approach to well-being. It's vital to continue working closely with your healthcare team to manage your overall blood pressure, keep high cholesterol in check, and maintain healthy blood sugar levels, particularly if you are managing type 2 diabetes. The Centers for Disease Control and Prevention, CDC, consistently emphasizes that comprehensive risk factor management is key to reducing the incidence of cardiovascular events like heart attacks. Adding diligent oral health care to this list strengthens your overall defense. Alongside prevention, being aware of heart attack symptoms, including the more subtle signs of silent heart attack, is critically important. This knowledge empowers you to act swiftly for yourself or a loved one. Understanding these signs is particularly vital when considering the frightening possibility of experiencing a heart attack alone. While we plan to cover what to do when having a heart attack alone and how to survive a heart attack when no one is around to help you in more detail in a future dedicated video, let this awareness today bolster your commitment to prevention. Many individuals who have recounted what they describe as near-death experiences stories often express a profound wish that they had been more proactive about their health sooner. We can learn from these powerful reflections and choose to act decisively today, starting with simple yet profound steps to care for our oral health, thereby safeguarding our heart. So, as we've explored together today, the connection between your oral health and your risk of serious heart diseases, particularly a heart attack, especially for those of us after age 50, is undeniable and profoundly important. Gum inflammation and hidden infections can indeed be those secret enemies impacting your heart. But the truly empowering news is that prevention is largely in your hands. By recognizing early warning signs, committing to diligent oral hygiene, and fostering open communication with your dental professionals, you can significantly reduce these risks and take powerful steps towards a healthier future. Please don't delay taking action. We wholeheartedly encourage you to schedule a comprehensive dental checkup with your dentist today. If you found this video insightful and valuable, we would be so grateful if you would click the like button, subscribe to our channel for more empowering health content, and share this video with your loved ones. Because sharing knowledge is sharing care. Your comments and questions are also incredibly valuable to us and help build our community. Finally, please remember that the information provided in this video is for informational and inspirational purposes only. For medical advice tailored to your individual health condition, especially if you have pre-existing conditions or are taking medication, always consult with your personal physician or a qualified healthcare professional. Thank you for joining us.